we are going to look at the Alzheimer's disease. And to start with questions, the first question is what are the early findings? The second one is comment on the histopathological findings of the Alzheimer's disease. So in this video, we'll find these answers and learn in detail. So to begin with, the Alzheimer's disease. The Alzheimer's disease, we need to know the age of onset. The age of onset is nothing but greater than 60 years. So greater than 60 years, you can expect the Alzheimer's disease. And then we have something known as the mini-mental. There's something known as the mini-mental state examination. That is nothing but the MMSE. So this MMSE is nothing but less than 24. Then we have the diagnosis. The diagnosis is basically by clinical. So what does this include? This includes there is 2 or more. That is, there is greater than 2 cognitive defects. Cognitive defect. Greater than 2 cognitive defect. And there is also the progressive worsening. There is a progressive worsening of the memory. So the progressive worsening of the memory as well as the cognitive function. And there is no disturbance in case of the conscious. So there is no disturbance. There is no disturbance in terms of the consciousness. And the other systemic causes, it must be ruled out. So you rule out the other systemic causes. So now we move on to answering the risk factors. What about risk factors? Risk factors, most important is the old age. So if you are older, you have higher chance of developing the Alzheimer's. So other risk factors it includes, they can be due to family history, it can be due to the presenilin. The presenilin 1, then there is also the presenilin 2 as well as the apolipoprotein. The apolipoprotein E4. So apolipoprotein E4 is nothing but the ApoE for allele. And then there is also the ubiquitin, and also the Down syndrome and the smoking. So all these are risk factors of the Alzheimer's disease. So then we are going to ask what is a protective factor. So what protects the Alzheimer's disease? The protective factor, it includes the NSAIDs, that is the NSAIDs and the apolipoprotein. It also includes the apolipoprotein. So this is nothing but the E2. Then we look at the causes. So what are the causes of this? So causes is that it includes the decrease in the acetylcholine. So there's decrease in the acetyl. There's decrease in the acetylcholine, and there is causes, and it causes depletion of the cholinergic neurons. So there causes depletion. There is depletion of the cholinergic neurons. There's depletion of the cholinergic neurons. And this is in the nucleus bacillus. This is in the nucleus bacillus. This is important, bacillus of the maynut. And this results in the short-term memory. It results in the short-term memory defect. So bacillus of the maynut, it results in the short-term memory defect. Then we look at some early findings. So what are the early findings of the Alzheimer's? So the early findings, if you see, it includes there is an anterograde. So there is anterograde memory loss. So anterograde memory loss, and this is the immediate recall effect. This is the immediate recall affected. And there is a distant memories which is preserved. And there is also the visuospatial defects, VP defects. There is also the language deficiency, language issues, and there is cognitive impairment, and there is also the anosognosia. There is also the visual processing dysfunction. This VP is nothing but the visuospatial defect. Next, there is also the difficulty in terms of naming. So there is difficulty. So what is the difficulty in? So there is difficulty in case of naming. naming as well as the repetition. So this is nothing but the lopopenic aphasia. Lopopenic aphasia. Then we look at the late findings. What are the late findings in terms of the Alzheimer's? The late findings, firstly, there is the psychotic symptoms, that is, you can have delusions. Then there is also the apraxia. Apraxia is nothing but the difficulty to perform certain motor tasks. So there is difficulty in performing the motor tasks. And then there is also the lack of insight. There is lack of the insight. This is seen in case of the Alzheimer's disease, lack of insight, and this is regarding the deficits. Next, there is also the non-cognitive. So there is non-cognitive. So non-cognitive neurological deficits. So this includes the pyramidal. So it includes the pyramidal as well as an extra-pyramidal. So extra-pyramidal, then it also includes the myoclonus and the seizures. It includes the myoclonus as well as the seizures. Then when you look at a patient of Alzheimer's, they also have a disturbed sleep. They have presence of the disturbed sleep. And this is nothing but the disturbed sleep-wake pattern. And then we also have, there is a urinary. If you see the urinary, there is urinary incontinence. Then there is also the loss of the procedural memory. Loss of the procedural memory. Now when we look at the HP, there is nothing but the histopath. There are nothing but a senile. There is senile plaques. The senile plaques, which is nothing but the amyloid deposits. The amyloid deposits. And then there is also the neurofibrillary tangles, NF tangles. And this is composed of nothing but the tau proteins. Then there is also the neuronal loss. There is something known as the neuronal loss. And there is also the synaptic loss, neuronal loss and the synaptic loss. Then there is also the granulovascular degeneration. Granulovascular degeneration, this is of the neurons. Then we move on to what about the CT and the MRI? What do they show? So in terms of the CT and the MRI, the later stages. So we have the later stages. So in terms of the later stages, there is nothing but the cortical and the subcortical atrophy. So the cortical as well as the subcortical. Cortical and the subcortical atrophy. This cortical and subcortical atrophy, if you see, it is prominent. And in the parietal. So it is prominent in the parietal. It is prominent in the parietal as well as the temporal lobes. And it is particularly, if you see, it is in the hippocampus. It is in the hippocampus, particularly in the parietal and the temporal lobes, particularly in the hippocampus. Then we are looking at the treatment. So how do you treat this? The treatment is by the NMDA. The NMDA antagonist. So NMDA antagonist, that is the memantine. So this is a NMDA antagonist. Then we also have the cholinesterase. The cholinesterase inhibitors. So what does this cholinesterase inhibitor contain? So it contains the donepezil. So it has the donepezil, the galantamine, as well as the rivastigmine. So to repeat, it has the donepezil, galantamine, as well as the rivastigmine. Then looking at the monoclonal antibody. So there is also a category of the monoclonal antibody. And this is against the AB peptide. So against the AB peptide, this is nothing but the aducanumab. So now we are going to answer our questions. So this was about the Alzheimer's disease. So the first question we asked was, what are the early findings of the Alzheimer's disease? So the early findings is nothing but there's an anterograde memory loss. There's an anterograde memory loss. Then there is also the viscospatial. There's viscospatial defects. Then there is also the language problems. There's the language deficits. And there is also the cognitive impairment. So cognitive impairment, and this progressively it declines. Then there is the anosognosia. Then there is also the visual processing. So visual processing dysfunction. So this is it is associated with there's a posterior cortical atrophy syndrome. Okay. Then it also includes there is difficulty in what? So when we look at it, there is a difficulty, and the difficulty is nothing but with the naming and the repetition. So difficulty with the naming along with the repetition. So this is known as the logopenic aphasia. So now we move on to the second question we asked. The second question we asked was, what is the histopathological findings in case of the Alzheimer's disease? So this includes, there is something known as the senile plaques. Senile plaques, there is nothing but the amyloid deposits. And it also includes the neurofibrillary tangles. The neurofibrillary tangles. So they are nothing but, it is composed of the tau proteins. And there is also the neuronal loss. There is a neuronal loss. There is also a synaptic loss. Then there is also the granulovascular. There is a granulovascular degeneration. So granulovascular degeneration, this is of the neurons. So this was about the Alzheimer's disease. To grow daily, please do subscribe.